Guys, welcome back to Medical Coding with Blue. Today's episode is all about why new medical coders should not only apply for entry-level positions. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, if you are a brand new certified medical coder, you may be noticing right about now that every place is looking for people who have experience. And you're not seeing a whole lot of entry-level positions. And how are you supposed to get in if no one will hire anybody that's brand new? The trick is that you go ahead and you apply anyway. When it comes to these employers and their requests for medical coders who have experience, they do want people who have experience because of the simple fact that they don't want to have to train. A lot of times if they're looking for people, it's because they're in a time crunch, they need to get this stuff submitted, and they need somebody who has experience who can just pick up and go. Well, when you have just passed your certification for medical coding, right? This says that you can code anything, anywhere, in whatever settings is applicable to your credential, right? If you have the CCS, that's the gold standard of medical coding credentials, or the CCA, this says that you can code inpatient or outpatient. If you have the CCSP or the CPC, this says that you can code in the outpatient setting. So if you're looking at these job listings and it says we are seeking somebody to code for our ER, right? Okay, that's a coding position. You are qualified as far as having the training. You just don't have the experience yet. But again, it is free to apply. So you can go ahead and throw your hat into the ring and see if they will give you a call. People who have really good resumes and who get to the point and who know and understand the importance of resumes are typically the ones who get calls back, okay? And then they're going to give you an assessment test to see, well, you know, no one else is applying because happy coders are going to stay where they are in that area. Coders who have experience are not going to move around, all right? So these employers are looking for people who have experience, and you happen to be the only one that's applying, and you don't have experience, but you just got certified, and well, let's go ahead and see if they can pass an assessment test, right? And so then that's when they give you an assessment test, and that's when you have to show them that you are competent to be able to start in this. Now these employers, they don't want to have to train somebody, and people will say, well, Blue, I didn't really learn a lot from my program. And there's a lot of things that I wish I would have learned because I felt like I was only taught to pass a test, right? This doesn't mean that you have to just give up because you can't find an entry-level position. You can teach yourself medical coding. It is possible because there's plenty of books. The books that I recommend are in the independent study video in the description box below, and it has all the books that you need. The two main workbooks, the ICD-10-CM and ICD-10-PCS Coding Handbook with the Answers, and the CPC Study Guide. Both of these will touch on everything that you need to know as far as like with coding, with diagnosis coding, and giving you practice with diagnosis coding, with giving you practice if you took a inpatient exam, right? ICD-10-PCS and those procedures. CPT is covered in that CPC study guide, okay? So even if you have an AHIMA credential, it is okay to use the CPC study guide because, again, the majority of the CPC exam is all covered in there it's all CPT. So that's a great and fantastic workbook. None of these companies sponsor me. This is not an ad for them. I'm just a medical coder who really loves medical coding, and I love books. So I will always share what I think is relevant and very helpful to medical coders. So if you feel like you're not ready because for a regular position that doesn't say entry level, even though you should go ahead and apply anyway, if you feel like you're not ready, then you need to practice with the workbook so that you can feel ready. You can feel more confident. That's the only way you're going to be able to get in. Now, I applied to plenty of places too, where they were asking for experience because I didn't see any entry-level positions in my area. And so when I started to apply for these positions that were asking for 2 to 3 years experience, 5 years of experience, I would get calls, but then, you know, it was just like, oh, okay, we got another candidate or, you know, whatever. Or they would tell me, you pass the assessment test, but we really need somebody who has experience and we have a rule at our facility. And you'll find those sometimes because it's just very close-minded, but to me, it's just what they do. So they want to have some excuse to not take somebody on that's, with no experience. But if that's the case, that's okay, because that place wasn't, in my case, that place wasn't for me. But they did tell me, when you get experience, please come back to us. It's okay. Trust me, I got a better deal. All right? Because even if you get rejected by a bunch of places, just know that that place was not for you. Okay? Now, the other thing that you can do is you can apply with a temporary agency. So a temporary agency for medical professionals, you can Google this. Please don't ask me, guys, in the comments, because I'm going to turn you back to the video. You can go to Google and you can say temporary agencies for medical professionals, and you will see a bunch of them pop up in your area. Temporary agencies that deal with the medical profession. So you'll see a lot of them that they're looking for medical billers, sometimes medical coders, sometimes it's just they need somebody in medical records. So getting those types of assignments, sometimes somebody may be out for just maternity leave or paternity leave and they need to have somebody to fill in. So they'll call in somebody who's certified as a medical coder. When you get these assignments from the temp agency, it's not one-day assignments. They're usually in like a few days, like 90 days or 30 days or something like that. When I got my first job, at the Cancer Therapy Research Center, and that was a temp agency assignment, and it was an assignment for 3 months. And that assignment led me to my next assignment, right? And I was just there for 8 months, and I was applying based on just that limited experience that I had. I was still applying at places because my whole goal was to get back home, right? And so that was driving me to be applying at all these places. And when I did hear from my forever home, my current forever home, I got the interview it was in February. And so I did that interview with them, and it was a great interview. It was not through the temp agency. It was by me applying. And then they were asking me at the end of the call, they were like, well, if you get selected, how soon could you start? I said 2 weeks to the day I get the call, because I got to put in my notice. And the call ended. It was great. It was a great interview. I was so excited. And then they didn't call me. They didn't call me. And that was just like, no, that was a really good interview. What happened, And so I ended up applying again when they opened up another position, but it was a higher position, and I still applied, and it still asked for 3 to 5 years of experience, and I still applied anyway. And you know what? I got the job. So that goes to show you that you can't let little words like that, like 3 to 5 years experience, must be experience, must have this, must have that. You cannot let that stop you from your goal of getting in someplace, right? So that's the thing. When I see people get discouraged because they say, well, everybody wants experience, just apply anyway and be confident in the training that you do have, and be confident in your ability to be able to learn quickly. I hear a lot of people, when they describe themselves, oh, I'm a fast learner, and I'm a team player, and I'm all of these things. And then when it comes to getting into medical coding, they're like, oh, I just want something entry level. I want something easy. I thought you were a hard worker. I thought you were a fast learner. What's going on? You have to talk the talk and walk the walk. If you say that you are a team player, if you say that you are a hard worker, then that is what energy you need to bring forth when you're out there looking for a job. And you are going to get rejected a lot. It happens to all of us. I went through that for 2 straight months. I went through the constant rejection, not really knowing or understanding just yet what I was walking into. I had a great resume, okay? Because I'm really good at resumes. I've always been a good writer, and I love to write. And with my resume, it was getting attention. The thing is that I didn't know how to respond to the questions, as far as like they say, okay, well, how many can you do per hour? What is your productivity? I don't know, because I hadn't worked yet, but I didn't know how to say that, as far as like, okay, well, what exactly do you mean? I was just like, well, I don't know, but that was a part of me learning, okay? And now that I know, now that I understand like the questions, and now that at that time, now that I got it, then that was when I started to see a lot of difference, okay? And then having those other 2 assignments with the temp agency, again, that experience was taken over to my forever home where I am now. And I started in inpatient professional services, or pro-fee, right? That's the clinic I started in, because that's where I came from at the previous hospital. I was doing professional fee coding that nobody wanted to do. I showed up there. I had to move several hours away from my home. Now I had to move, okay? If you cannot move, that is fine, okay? But I'm just sharing my experience. Please don't feel like you have to be compelled to move from your hometown or anything like that. I'm just telling you guys my story and what I went through. Not everybody goes through the same thing. But I'm telling you guys so that way you understand where I'm coming from. This is a sacrifice. This is what I went through to get to where I am now. And part of that was applying for those places. Again, they were asking for 3 to 5 years of experience. Okay? You cannot let that discourage you. You cannot let people telling you on these interviews, no, you don't have experience. No, we want this, or no, we want that. Every time you go on an interview, it's giving you experience so that you can take that to your forever home. Now, it may be a few times that you got to go out there, all right? But it doesn't mean that it's all for nothing. It's getting you more confident. It's helping you to understand what is it these employers are looking for. Now, trust me, if you get an interview, if they give you an assessment test, this is a gift, okay? This is a gift, whether they hire you or not. Because getting that assessment test and you going through that assessment and you seeing if you pass it or not. Now, a pass-fail on these assessment tests is not necessarily a bad thing, okay? Some people will get these assessment tests, they'll score a 90, and to that facility, that's still too low. That's considered a fail. And sometimes they won't tell you what you got wrong. Sometimes they will, okay? But they usually don't, because they try to keep these documents internal, because if everybody knew what the answer was, then everybody could pass these assessment tests, and they certainly don't want to have to come up with a bunch of different quizzes for assessing somebody's knowledge base, okay? So that's the thing that you have to think about when you're applying at these places. But, excuse me, if you happen to fail their assessment test, right? If you happen to fail their assessment test the first time, you can ask them, can I take this again? And if they let you take it again, great. Sometimes they will and sometimes they won't, but it never hurts to ask, okay? So if you find out that you failed, ask them, would you consider letting me take another chance at taking this exam, this assessment test? You know, I was just nervous, you know, whatever the case may be. But just ask them straight out, you know, and sometimes they'll let you do it and sometimes they won't. Again, they want to see where you are. This assessment test tells them how much training and how much knowledge that you do have. And because of that, you know, then you're going to be able to either get in or, you know, you have to keep applying. And if you are failing these assessment tests, that says to you, again, more valuable information, that you need to go back to the books and you need to keep studying. If you don't understand something, if something doesn't make sense to you, 2 things: find a mentor or find a tutor. A mentor will help you for free. This is somebody who's in the industry, who volunteers their time to help people. And then, you know, if you want to hire a tutor, that's fine. Hiring a tutor is great, because sometimes you have to spend a few bucks in order to be able to, you know, have somebody explain to you whatever it is that's, you know, giving you troubles, all right? So that's okay if you have to do that. And sometimes that's what you need, because not every instructor in these schools is meant to be an instructor. And because of that, you know, sometimes students are just lost. But it's not a reason to give up. It's not a reason to say, you know what, I'm just tired of this. I don't understand this. I can't get a job and I don't understand it. You know, this is confusing to me. And rather than just throw it all away, and this is thousands of dollars that you've thrown away, rather than do that, say, you know what, I'm going to get this. I'm going to try my best and my hardest to understand this, and I'm going to find somebody who can help me to understand, whether it is finding a mentor. And you can go on LinkedIn and you can make a post and say, I'm looking for a mentor, somebody to help me with my coding questions, I'm brand new. Anything, right? Just make it very directed to the point. You don't have to beg, you don't have to complain. Please do not complain on LinkedIn about your struggles finding a job, because trust me, they've all heard it. We have all heard it. And the degree of separation in the medical coding world is very small, all right? A lot of people know everybody, and there's a lot of people who are connected to a lot of people. So just make sure that you are very direct and to the point, and not complaining in your post on LinkedIn. If you are looking for a tutor, again, I am a tutor. My rate is in the description box below. There's a ton of tutors on LinkedIn. You can always ask for a recommendation. Does anybody know a good tutor? You know, that is totally fine. And there's going to be varying prices on the tutors as well. But you have to consider this as an aside. When you are looking at how much something costs, you have to consider that, you know, if the price is in a little bit of a higher range, is because that person's bringing a lot more experience and there's a lot more to their sessions, right? As far as, you know, being like on Zoom or something, you know, and not just a phone call, or not just over text messages. There's a lot of differences, okay? So something to consider. But don't let just a few words on a job ad stop you from applying. And make sure that your resume looks good. I say that all the time. Resumes are your calling card. That's going to be the first thing that the employer sees. And if you are somebody who's brand new with no experience and you're running around trying to find a job, but your resume does not look good, your resume is maybe 2 or 3 or 4 or 5 pages, like some of these resumes that I see on LinkedIn. Guys, don't do that. The resumes should be 1, but no more than 2 pages. And you should only go back on your work history 10 to 15 years. That is it. They don't need to know that you worked in the 90s. They don't need to know that you worked in the early 2000s. They just need the most recent experience. And if you think that you have nothing to offer from your previous positions, trust me, there's a lot of transferable skill. And you have to think about those things when you're getting it onto your resume, all right? And you want it to be to the point and very concise. You don't want to sit there and, you know, put all this fluffy stuff on there. You want to make sure that whatever you did, it's not as technical to that position, like you're writing it out, but you want it to be where if you had to protect private information, then you say you did that. Why? Because medical coders protect private information. Did you work with Excel spreadsheets? Why? Because coders tend to work with Excel spreadsheets as well. Did you have to work with the public? Did you have to de-escalate situations? Why? Because coders have to have really good interpersonal skills as well, okay? Being able to talk with all different kinds of people. That's important to know. And those are really good and valuable transferable skills that you can possibly put onto your resume, okay? So I have a ton of videos on my channel about tips for resumes for brand new medical coders. Again, if you want to book a session with me, my rate for rewrite is in the description box below, and along with my contact information. So again, if you're interested, please check out the description box. But yes, to wrap this up, guys, you will get where you want to go. And sometimes it's going to take you to look at different titles, okay? Not just medical coder. Sometimes medical coders are listed under different titles. Health information technician, medical biller coder, medical biller. And sometimes when you look at the listing, it says this biller is also doing the coding. So that's something to think about. And if you want to try to get into an alternative position just to kind of get yourself some more transferable skills before you get into the coding, that's always a possibility as well. You can apply for those. Medical biller does not require you to be certified. It does not require you to have experience a lot of the time. And even if it does, even if you came from background of retail, That is the same thing. Why? Because you're handling cash. You had to balance a drawer. You had to do all those math things, percentages and stuff. And so again, transferable skill, so that you could put that on your resume. All right. Medical biller. It's not a data entry. It is charge entry. Charge entry. That's giving you exposure to the medical codes and getting you exposure to the electronic medical record. Very important transferable skills. Prior authorizations technician or prior authorizations specialist. They change the names, okay? So it just depends on where you are, right? But that person is a person who gets the record from the doctor, and they're the ones who call the insurance company and say that the patient has this condition and the doctor wants to do this procedure. Is this approved? Those are transferable skills. And prior authorization specialist does not require you to be certified. It does not require you to have experience either. So those are some things that you can look at into getting into. And these are just suggestions, guys. You certainly do not have to go with those alternative positions. If you want to seek only medical coding, by all means, I understand. Go ahead and seek only the medical coding positions. But just for the alternative sake, if you wanted to seek something that was alternative, then you could try those other positions. That's just my advice anyway. Again, my advice is here to help you. It's here to give you some other options that you may not have considered, right, before. And so that's something that you can take with you, go forth, and try to find something. But the other thing that I will say before I wrap this up, where you start is not where you will stay a lot of the times. So if you are starting at some place and it's not the greatest thing, not the greatest position in the world, but it's something to get your foot in the door, that is okay. If you want to stay there 6 months and move on to find another job, that is okay. There is no shame in going from job to job for a little bit until you find where you're going to be at, where you need to be. This happens sometimes with people who will start off in risk adjustment. And you got to be careful with risk adjustment. Risk adjustment is only diagnosis coding. It has nothing to do with procedures. It has nothing to do with evaluation and management. And if you only stay in risk adjustment and you spend years there, you lose your skill, guys. And if you look at the job listings, sometimes they will say if your experience has only been in risk adjustment, that does not count as experience. So keep that time with the risk adjustment short. Get your experience and move on, guys. It's okay to do that, because at the end of the day, these companies have to look out for themselves the same way that you have to look out for yourself and the development of your career and your skills. Okay, this is my advice anyway. So apply for those jobs, whether they are asking for experience or not, because like I said, it is free to apply. But bring them a good product so that they feel like they made a right decision when they decide to hire you, should you get the job. I'm just saying. So if this video helps you, please like, subscribe, and share, and I will see y'all next time. I'll be live tomorrow at 7:30 p.m. Central Standard Time on Friday. I'll see y'all then. Bye.